Natural wild poliovirus is harmless under normal circumstances. In fact, the virus used for the vaccines were obtained from children who were totally well. The paralysis that the world witnessed in the first part of the 20th century was largely from toxins in the environment like DDT, lead, and arsenic. Those toxins seriously disrupt mucosal immunity, allowing a previously benign virus to bypass the innate immune system and cause paralysis and other clinical symptoms. Where those chemicals are still used today, you'll still see reports of paralysis, which used to be called polio, but authorities now call it acute flaccid paralysis. In 1950, anything that looked like today's acute flaccid paralysis was called polio because the medical profession never looked for a virus. Today, unlike the pre-vaccine era, the health department looks for poliovirus in people who become paralyzed, and they hardly ever find it. In 1958, during a large polio epidemic in Michigan, the United States medical authorities analyzed stool and blood specimens for over 1,000 hospitalized patients who were diagnosed with poliomyelitis. To their surprise, they found that only about 1/4 of those diagnosed with polio showed evidence of exposure to the virus. By checking all patients who were diagnosed as poliomyelitis for the virus, they were forced to remove about 3/4 of all polio cases. This new way of checking for poliovirus in blood and stool helped to effectively eradicate polio because poliovirus was only found in a minority of those who were paralyzed, and only those cases were counted as polio. That means of eradication could have been done with no vaccine at all. After the vaccine campaign, the diagnostic criteria for polio were drastically altered. Before the vaccine campaign, if someone was paralyzed for a duration of 24 hours, they were considered to have polio. After the vaccine was used, that length of time was extended to 60 days. Normally, most people recovered within 60 days, so the new definition removed even more polio cases. That decline in polio was only technical and had nothing at all to do with the vaccine. The type of polio vaccine used in Israel since 2004 is the inactivated polio vaccine, otherwise known as IPV, or the injected vaccine. It doesn't stop virus transmission or infection at all. It's designed to make antibody to the virus in the bloodstream. But since polio infects and replicates within the bowels, an antibody in the bloodstream cannot stop transmission from person to person. The authorities know that the antibody they call vaccine protection is neither long-lasting nor reliable. Some people are vaccinated and don't make much antibody, and in those who do make antibody, it can degrade very rapidly. Many vaccinated people are walking around non-immune to poliovirus, yet there are no cases of polio in Israel from wild virus. Where are all the polio patients? Injected polio vaccines do not control the spread of poliovirus, and the oral polio vaccines can spread the vaccine virus, which in immunocompromised people has the ability to chronically infect and to paralyze. For the long-term health of your children, learn both sides of the argument. Learn how to keep your child's immune system strong with good nutrition, avoiding antibiotics whenever possible, and avoiding toxins. And make sure you get enough vitamin C. Understand that the practice of vaccination is based on very shaky foundation, and that vaccinology, as portrayed to the public today, is religion written on the back of ignorance. Could the reasoning behind the current vaccine campaign have little to do with polio control, but something to do with fear-mongering and emotional blackmail to coerce parents to comply with medical dictates? Please learn the history of vaccination before giving your child any more vaccines.